Hey guys, good afternoon. It's Dr. Hannah and Dr. Rachel here today. We're going to be talking to you about ear infections. So ear infections are something that a lot of mommies will see in their kiddos. It's said that actually 90% of kiddos will experience an ear infection within their first 3 years of life, at least once. So our job as chiropractors is to be proactive about that so that kiddos don't experience those at all. So we're going to talk about a little bit about what an ear infection is, a little bit about the anatomy of the ear, and then some remedies that we think are important for moms to know or have in their arsenal. So a little bit about what an ear infection is. So typically when you go into the doctor and they tell you you have an ear infection, you're going to hear the word otitis media, which just means a middle ear infection. So there can be an infection to the inner ear, but we're talking about a middle ear infection here, which is the most common, which would mean this is the outer portion of your ear that you see here, where you stick a Q-tip in. The middle ear is going to be right past the eardrum, or the tympanic membrane. You might hear that word as well. So what it is it's actually going to be a breeding ground of bacteria or virus particles that have become an infection. So there's a difference. Sometimes you might have fluid in the ear, and that's just a normal process of drainage that kiddos will have whenever they have colds or allergies or things like that. And that fluid typically should drain from the ear down into the throat. Now, when an ear infection happens, that's typically whenever the drainage is not happening properly. So what happens is the ear is connected to the throat by something called the eustachian tube. It's a little tube that drains that fluid. So when that tube becomes swollen due to something like a cold, then the fluid is caught in the middle ear, and that's when the infection occurs. So the difference between a child and an adult, the reason why kiddos tend to get more ear infections than adults do is because their eustachian tubes sit more horizontally. As they grow, then gravity tends to help us out a bit because they grow more vertically. So that's something to note as well. So our bodies are really designed incredibly and intelligently, and we have the ability to heal on our own. That is the really cool thing about our bodies. Our immune systems are learned. So a lot of times when you go into a medical professional, you might be introduced to antibiotics. Now, the American Academy of Pediatrics actually does not recommend antibiotics for ear infections anymore to be the first line of defense. So just, take that into consideration. We're not anti the use of antibiotics, but we're anti the overuse of medications and antibiotics.
That's actually one of the most antibiotic resistant issues right now, is because that's one of the first things that is prescribed for kids with ear infections. And so more and more kids are becoming resistant to antibiotics because of the constant medication that they're getting for ear infections. So if we can break that cycle, then when you need the antibiotics, they'll definitely be more useful to your body and you'll get more benefit from using them.
Right, because sometimes they're prescribed just by merely looking in the ear. So what they're going to do is look in the ear with an otoscope and see that that tympanic membrane is going to be inflamed, red, swollen, and it's going to be bulging out a bit. And like I said, there would be pus on the inside or infection, so it would look like white. And oftentimes that might be hard to see on a kiddo that's squirming around. And a lot of medical doctors might feel pressured into prescribing an antibiotic because moms are kind of at their wits' end with kiddos who are in a lot of pain. Ear infections aren't fun. So our job is to help you not get to that point to where you feel like you need to do that. So that's a little bit about why we recommend going that route. We want kids to avoid tubes in general because typically after so many ear infections in a 4 to 6 month time frame or even a year, then tubes will be recommended, and that's where they put a little tube into the eardrum and it's supposed to drain the fluid. Well, our bodies weren't designed that way. They were designed for the fluid to drain down into our throats. In children, it's natural to have bacteria in and around our midst. So our mouths are constantly open. We're always talking, we're eating, we're breathing. So bacteria is a normal part of life, and it's always going to enter through our mouths. So we just need to make sure that those tubes are draining properly and doing their jobs. That's all. Dr. Rachel's going to give you a couple of things that we should do in regards to prevention of ear infection, or once you already have them, what we should do.
So obviously our first line of defense would be a regular chiropractic schedule for just maintenance for your baby, especially when they're teething and you notice that they have an accumulation of fluid from drainage out their nose, or they tend to be pulling on their ear. Those are signs that there could be an accumulation of fluid that's backing up. So go ahead and bring them to your chiropractor, get it checked for an adjustment when you notice those signs to try to facilitate the draining process. Usually if a child does have an ear infection, I like to check them at least twice that week, if not 3 times, depending on the severity and if there's pus present, and so on and so forth. So obviously, a lot of the times this type of stuff happens at night when the baby's sleeping or laying down, because it is more painful when they're lying down. And so many times people don't have the ability to take them to the chiropractor right away because it's at night when it starts. So I want to be able to give you some tools to be able to use them proactively at home. So if this happens, say on a Saturday night and we're not open until Monday, you at least have something to fall back on. So I'm going to give you a few of the top remedies for ear infections. One would be garlic oil, putting a drop or 2 of warm garlic oil in the ear once to twice a day. Garlic oil is antimicrobial and antibacterial, and so it can really help to build the immune system and fight the infection. Making sure that the baby is on a probiotic, or the child is on a probiotic. This naturally can prevent ear infections. The stronger their gut flora, the less likely that they would be to have an infection even start. So making sure that you're being proactive and having them on a probiotic, especially this time of year. Sugar is also one of the things that can weaken the immune system, that can lead to infections coming in. So if you can decrease the amount of sugar that you're giving your child and increase the probiotics, that is going to stimulate their immune response. Also, making sure that you're not giving them allergens that can make the mucus build up or make the fluid worse. So we're talking dairy, we're talking gluten. Being around cigarette smoke can increase the chance of ear infections. So those are things to avoid if you do have a prevalent child get ear infections frequently. Removing those from their diet, and also possibly getting an IgG test to see if there's any other allergens that could be potentially causing issues. A lot of kids who have allergens naturally tend to be more prone to getting ear infections as well. So looking into that is something that you might want to look, at least try to figure out if it's a recurring issue. Colloidal silver is also antibacterial. It can have antiviral properties. So putting a little bit of that in the ear 2 to 3 times a day. But if you are a nursing mom, breast milk, it is amazing. It's liquid gold. You can put it in the eye for conjunctivitis, in the ear for ear infections. So just put a couple of drops of that in the ear 3 to 4 times throughout the day as well. Very, very beneficial for promoting healing in the baby, and also it's easy. It's free. You don't have to pay for it. It's there readily available. So along with breastfeeding, this ear infections typically are more prevalent in the baby who is bottle fed and who is lying down. So if you do bottle feed, try to make sure that you're keeping baby upright and it's not something that they're doing lying down, because that can perpetuate the problem as well. So with this, there are some tools that you can do when the baby has an ear infection, and then tools that you can do to try to prevent. The warm compress is another thing that you can do for pain, as well as essential oils for pain. So Melaleuca is one of the best for ear infections. I also like to pair it with lavender and basil, and I'll put it in a little roller bottle or dilute it with some coconut oil and apply it to the mastoid bone right behind the ear several times throughout the day. Never put the essential oils directly in the ear. That is a no-no. It can affect the mucous membrane, the tympanic membrane. It's very, very sensitive, so you want to avoid that. Something else that people should be aware of, like Dr. Hannah mentioned, fluid does not always mean infection. So be very cautious about accepting an antibiotic at the drop of a hat, because when you take the antibiotic, it's wiping out all your gut flora, and then you have to kind of start over, and this gets into a cyclical effect of they're getting sick, they're better for a couple weeks, and they get sick again because their body doesn't have the resistance that it needs to fight the woes of the world during the winter season. So I think that is usually all that I do. I have 3 kids, an almost 8-year-old, a 5-year-old, and an almost 3-year-old. And only one of my children have ever had an ear infection, and it was actually just a couple months ago. Everly got one when she was 5. None of my other kids have had an ear infection. I was able to clear it up at home without the use of antibiotics. I was adjusting her, checking her daily, using the breast milk, the colloidal silver, and the garlic, and the essential oils behind her ear. And she was only uncomfortable that very first night when I didn't know about it. And then afterwards, the nighttime, it was so much easier. Having a baby in pain is so hard on the mommy. So these tools just help to give you some of your power back and confidence in taking care of your kids. So before we go much longer, we're gonna go ahead and stop because we have a tendency to talk. So we hope that these were helpful tools and that you can get some benefit out of them, especially this winter season. Thank you.
Have a good day.